Oh, there we go. I know it's been another challenging half term, and I'm sure that will be raised during the next hour with you as well. But I just want to say well done for almost getting through to half term as well. You're still doing an amazing job. And I know that some of you are doing that in quite challenging circumstances. So that is wholly acknowledged. But we'll try and work through how we give you further support and further advice and guidance this morning. I'm going to hand over to Mike just to cover a little bit of the epidemiology. And then, Mike, I think we probably need to go into the contacts and the siblings straight away, because that will probably be part of the dynamic of the conversation this morning. So it might be better to have that and talk that through to begin with, if that's okay, Mike.
Thank you. So the overview, that the rates in nationally are continuing to increase, and they're starting to increase more quickly now. So the average rate nationally at the moment is about 435 per 100,000. And if you think about it, when we moved into this time last year, actually, into a higher tier, the rate's about 100. So they peaked at the very, very worst at about 1,200. So what we're seeing at the moment nationally is kind of a rate of about 430 and going up. In Essex, for the first time in a long time, we're now higher than the national average. We've got a rate of 440, which is somewhat below the regional average of about 450, 460, but it's still going up. The position across different Essex districts is starting to sort of spread out a bit. Chelmsford's got one of the highest rate. Interesting, Ipswich now got the highest rate nationally. Within Essex, Chelmsford has got the highest rate, which is kind of a whisker below 600, but will go over 600. But in contrast, Epping's about half that. Interestingly, it looks like, to me, a lot of the urban areas are seeing less increases than elsewhere. I just wonder if that's down to school transport, but it may just because they got hit worse before, and therefore things spread slower. However, I think things are spreading in those areas and going up as well. I think one of those features we're starting to see in terms of schools is, as you all know, there are very high rates in secondary schools, but as a lot of you will know, there are now increasing rates in primary schools, and in some areas the rates are pretty high. So I think in Colchester, the rates in the primary school aged children and below are kind of greater than 1,000 per 100,000, so pretty high. And they're going that way in Malden, in Tendring, in Rochford as well. So one of the features that I think we will see is more primary school outbreaks and more cases in primary schools as you go on. Secondary schools, some areas it's levelling off and going down, and there are other areas it's going up, but broadly speaking, it continues to increase. So the rates in secondary school children are probably about 1,700 per 100,000. The big issue for me is, first of all, does that translate into older people who are going to get ill? And secondly, does that translate into those people getting ill? We are now starting to see some move into older people. We usually look at the over 60s as a group, which is probably not ideal, but in that group, the rates are going up to about 170 in coming days, so about a tenth of what we're seeing overall nationally. So overall in the secondary age group. However, when you break that down, the over 80s, the very elderly, are well protected. They don't seem to be seeing an increase, but the 70-79s do, and also the 60-69s. And I suspect they're the grandparents of the children. But the over 80s are probably too old to have any link to schools in any way. They're probably too old to be grandparents of school-age children. So I think that might be why they're protected. The good news, though, is it is not translating in hospital admissions at the moment. So the numbers of people in hospital with COVID are remaining stable. And that's actually that's particularly impressive because this is people in hospital with COVID, not people who are ill with COVID in hospital. And just as the background rate goes up, you would expect to see more people in hospital, because they, I don't know, got a boil on their bum or something, but happen to be COVID positive. So there's a distinct. So at the moment, we're not seeing an increase in hospital pressures and in hospital admissions of people sick with COVID. That may change over coming weeks because we're seeing a large increase, but I'm hopeful that the vaccination program has prevented that from happening. So then I want to move to the vaccination program, because the critical issue then is to protect those vulnerable people. If one looks at the effectiveness of the vaccines over time, and this is real-time data because they haven't been around that long, there does appear to be a drop-off in the effectiveness of the Astrozenica vaccine in particular. after about 5 months. So the need to vaccinate with a booster the people who had particularly the people who had the Astrozeneca, who actually tend to be the older people and more at risk anyway, needs to happen as soon as possible. As soon as those people hit the 6-month mark where they're eligible to it, they should be getting the vaccine. So in terms of the health and well-being of the wider population and protecting the NHS, the key issue is to bring the vaccinations boosters in as quickly as possible to that group for COVID. Increasingly, I think there is talk about Plan B. I don't think Plan B is going to be a lockdown. I think Plan B is going to be the reintroduction or the voluntary reintroduction of some measures to sort of help, temper the spread of COVID. The obvious one for me is work from home where you can work from home. That's one we've actually not really departed from much at Essex County Council, but I think it is one that remains quite important. I think bringing back social distancing where it's possible to do so easily, so you don't actually have to go. I just say to people now, I'm sorry, I'm not shaking your hand. I'm not being rude, but I'm not shaking your hand anymore. I'm not shaking hands anymore. So just not doing stuff like that and just not getting close to within 2 meters of people where you can avoid doing so. I think that's quite important. I think regular testing is really important. So if you do get positive, you can move out of the system. I think I don't think we're going to see lockdowns. I don't think we're going to see anything legislated for. One other thing that's quite interesting, quite positive at the moment is I noticed that Premier League football teams, through work with the Assistant National Director of Public Health, have now agreed to ensure that everybody attending those matches is either double vaccinated or has a recent negative COVID test. So I think that may lead the way for a more measured approach with COVID safety in mass gatherings. So I'm sure you're going to ask all the school-based stuff. So that's kind of where we are more widely in terms of the context. Cases are going up, no pressure on hospitals yet. Big worry is waning vaccination in particularly the most vulnerable who've had AZs, and the real priority is to get those boosters into people. Thank you.
Great, thank you indeed for that, Mike. Mike, there are a number of questions have come through. Can we just talk about the guidance we issued on Friday about the moment? We know other local areas, I understand now Southend and Thurrock have advised that contacts do not attend school whilst waiting for a PCR test. That isn't our advice in Essex at this moment in time. Do you just want to explain a little bit more about that, Mike? I know we only issued that on Friday. We are keeping that under review, but that was, as of the data and the evidence we had on Friday, the position that we took. Mike, can you explain that in a bit more detail?
Yeah, thank you. So there's a number of elements to this, and it is a little bit nuanced. So broadly speaking, there is a lot of COVID in secondary schools at the moment, no question about it. The question is there a merit in excluding siblings? Will that prevent that spread? Well, I think if there's already quite a lot of cases, it won't, because there's already quite a lot of cases, and that spread will happen within the schools. If you did exclude them, what are you actually doing? So what we would want, what you're trying to do is to suggest that person is at particularly high risk of becoming a case. You're doing a PCR test on them. If the PCR is negative, then you're sending them back to school. However, we don't know if the epidemiology of this thing is, excuse me, if they're positive, the LFD pick it up anyway in most cases. If they're not, they may be incubating. So the point at which you take that PCR is a time where they may or may not be at a position of incubation where it goes positive. It may well be that they have a negative PCR and 2 days later they get symptoms and positive anyway, because that's what happens. That's why people have to exclude for 10 days. So you either say, look, you have to stay off for 10 days because you're a contact, or you say you don't have to, there's no point in staying off. So actually there isn't a lot of sense in saying, well, you just stay off and on the off chance that you're going to get a positive test on a PCR that isn't a test on a not going to be picked up on your LFD in the next couple of days, and then you'll be all right. So the impact is marginal, and that's assuming that that person is going to be particularly responsible for spreading infection further in the school that's already got quite a big outbreak anyway. The downside of that is that children will miss education, and we do not want children to miss education. So the balance is, where will the children as a group miss more education? If you exclude the siblings, or if you allow the siblings to attend, and then potentially some more people in the school will get it. Well, if I had clear evidence that stopping the children from attending prevented further infections in the school, then I would support that approach. As I can't see any evidence for that, I don't. I've got evidence that children whose siblings might start spreading it, but that doesn't mean it wouldn't have happened anyway. So the position of Public Health England, and I talked to the people I think are smart public health, in particular David Edwards at the moment, who's the acting regional director for health protection. He agrees with me, and that is also the position that nationally Public Health England is taking on this. So I think there's people feel a pressure and a need to do, but sometimes the doing, you have to really measure whether the doing is going to do more harm than good. So at the moment, this is not something that I would advocate in Essex schools, but I'm happy to be challenged.
That was very clear. I can see Nick has got his hand up. Do you want to come in there, Nick?
Yes, please, Claire. Morning, Mike.
Good morning, Nick.
I'd like to just put a bit of challenge into that for you, really, because we've seen evidence of the sibling spread. Couple of areas here that I'd like to pick up on. You know, your first point was it's likely we're going to see some measures coming in and to work from home where possible. So none of the teaching staff can do that. We actually have to be in a building. So we don't have that opportunity to social distance and protect our staff. Therefore, we have to be in COVID positive environments without any choice at all. And what we're trying to do is limit that COVID positive environment. I think your teams are also probably thinking that the parent body is very effective at lateral flow testing and the home test PCRs, which they aren't. So an absolute example for you, we had a child come into school, home PCR, didn't want any of the swabs put in their nose or in their throat. So parents agreed to allow the child to blow their nose and then dab the swab in the tissue to do the test. So you've got an unreliable testing group at home, whereas the PCR test centres at least put some control measures in as to whether or not you've got an asymptomatic or symptomatic child. So I think the argument that we might be putting forward here is that the evidence is showing that siblings are picking it up within fully COVID positive households. And if you can get to a testing centre, the turnaround for a PCR at the moment in a testing centre is between 24 to 36 hours. We're already likely to be in a COVID positive school providing remote learning for some children, so to put an additional child into the system for remote learning for 36 hours isn't going to make much difference to the teaching staff, but it will release some of the anxiety that teaching staff have, where we're trying to manage the entire system going in. So we've got a couple of sets of rules. Outside of school it's okay, we're social distance, work from home, because case numbers are rising within Essex now, but in school, well, they might spread it anyway, and hospital admissions are down and your younger sort of staff. So what I'm pushing forward here for is, you know, the approach of actually, if you're in a highly COVID positive environment, 36 hours on remote education means children aren't losing their education, but you are supporting schools where staff are very anxious in COVID positive environments. So could you take that back to the team for me?
Yeah, no, absolutely. So, so the position for people to work from home is not necessarily to protect them; it's to prevent the spread more widely. But obviously it will protect them, but it's more about preventing the more widespread. The difficulty remains that you can't. It's hard to say whether those outbreaks would have happened anyway. One of the issues is that why would you want to test the child at that particular point with a PCR? In the past, we never did that. When we were serious about exclusion and about contact tracing and excluding contacts, it was 10 days, 14 days. And that is correct, because you don't know when this thing's going to emerge. So just because you have a negative PCR test a day later, it actually doesn't mean much, because most times the incubation period is several days anyway. So it is not, you're just going to be excluding a group of children who actually, many of them will not be infected, and many will be infected, but they'll be infected later. So it just doesn't ring true to me. But I understand what you're saying.
So, Mike, so jumping in on that, at the moment we are recommending that schools ask parents to get PCR tests for children who are close contacts when they know that that's the case. So are you suggesting that there isn't much point to that? Should we not be asking parents to get PCR tests for those children?
So you're doing a big group there. So I think that is helpful because you may pick some up. But I think more important is, and I know that's going back to Nick's point, is the regular LFTs, because that is what will pick them up as you go through them. And even stepping up the LFTs daily if you need to, if you've got an awful lot of cases in a really high risk group. Recent evidence is actually being quite kind to LFTs. It's suggesting actually they're pretty effective at picking up probably more cases than we thought originally. Mm-hmm. So I think that is something we should approach. But no, we should be doing the PCR still. But you're still going to miss them for the reasons you've said. Mm. The whole thing is, this is about keeping as many children in school as possible. And that's a balance between excluding the children and keeping them in. The way to, if you want to minimize the cases in schools, you do the bubbles and you exclude the bubbles. And we're not doing that. We're not in that world anymore. You've then got to think what is effective and what is going to cause the minimum overall levels of COVID or exclusion in school, whether for COVID or whether due to the impacts of interventions to prevent the spread of the COVID.
So Mike, you mentioned regular LFTs, and obviously they are getting a better press now, which is helpful. And several people have said in the chat, should we now be asking primary age children to take regular LFTs, because at the moment that only applies to secondary age children?
I think that would be, and given the levels we're seeing, I think that would be appropriate.
So we perhaps need to take that back, because at the moment there won't be those, there isn't that provision within primary school.
I think we just need to be very clear what we're saying here, Mike, as well. Obviously, secondary schools are administering LFT tests for the twice weekly testing, and that's not an arrangement for primary schools. So I think that would still be through the community route, but household testing is something we have been promoting, and we know that children under 12 are being regularly tested. But I just want to avoid confusion. We're not saying at the moment that would be a national policy that primary schools would do the same as your secondary colleagues. That is not something that's coming down the national system.
It's not sorry, it's me. I believe that given the rates we're seeing in primary schools, there may be merit, and there would be merit to regular LFT testing within primary school children, particularly as they may be less likely to show symptoms than other groups.
So Mike, I think to save the question coming through, then there probably is a letter that we need to issue to primary schools, to issue to parents, to say that if they are not already partaking in regular LFD testing, we would encourage them to do so.
Yeah, we can only encourage, that's all, but it wouldn't be a national programme, no.
Is that clear for everyone?
I think it is, but it needs to be very clear, doesn't it? Because I think the message could easily get out to schools with some confusion that primaries are meant to be supplying lateral flow tests to parents. I think that parents might read that message, and I think we need to be careful that that isn't the case.
Agreed.
No, I agree, but there's no recourse to you providing the tests anyway. So I think there's an easy answer there, that there's no recourse to primary schools providing the tests because the arrangements are not in place for you to do that. So it would have to be through the community routes. Okay.
So can I be really clear? Because you know I like clarity, Claire. So we're talking now that we're possibly, after this meeting, going to move to a letter coming from you and Mike suggesting that families through the community route lateral flow test their children twice a week during term time to avoid going to PCR centres, postal PCRs, unless obviously they're symptomatic and get a positive LFT. But we're suggesting twice weekly PCRs through the community, LFTs through the community route.
So I think it's probably something we want to go and discuss a little bit further. But given the rates that we're seeing in, let's think of Colchester now, we've got rates in the that younger age primary age group of more than 1,000, 100,000. That I think that we should be pushing for regular twice weekly testing in those children, directed by the parents using the community systems to do so, but not PCRs, LFDs.
Okay, that's really clear. I'll wait for the comments.
we'll take, Mike and I will take that outside this meeting, because there's also a lot of detail now being asked about will this apply to infant children and so on and so forth. So Mike, we need to take that offline, because we need to give some clear detail as to what we're saying. I mean, we are aware, I think the evidence is very clear, that there are many families who are lateral flow testing their children. How primary age children are being identified as being asymptomatic positives. It must be through that route, because we've had positive asymptomatic children all the way through since the beginning of term. So that is something, but I think if we are going to formally endorse that from a local authority point of view, we just need to be very clear what we're saying and on the detail, Mike.
Yeah, no, I agree with that. We'll take it offline, talk to Danny as well about it. But
Okay.
I just think that at this point, with the rates we're seeing, it's probably makes sense.
Okay. I think that deals with the contacts and the siblings then, and an action for us to take away about maybe just increasing the frequency of lateral flow testing for primary age children, with some detail to be worked through. There are a lot of questions that are in the chat, an awful lot. I'm just going to try and work my way through them and see where we get to. So I'm just starting at the top and working down, forgive me. So Jenny, you're asking about, would it be a good idea to ask all children to PCR now as possible contacts? Yes, that's been our advice all the way through, and you should have a letter that you can send out to that effect. So what we agreed at the last one of these, or at some point during this half term, is that we do appreciate, and I think I said this at the EPHA executive, that there are limitations with contact tracing, and those limitations are more stark within primary schools, because it is dependent on the information that the children give to track and trace to enable contact tracing. So to add into the system, the request was that you ask for the class, for the children in the class to have PCR tests, in order that we're not contact tracing. I have to be very clear, we haven't asked you to contact trace, and we're not asking you to contact trace, but this so that the class is deemed the whole class is deemed a contact, and therefore to seek to get a PCR test. There's a question from Harriet. Sorry, there's a question about should schools be putting in more measures around wider parent activities, Mike? And I know that we were okay about this when we spoke to the secondary colleagues a few weeks ago, but there are nativity plays coming up and things like that. Have you got advice on whether the school should be restricting activities that have a high number of adults in attendance?
So I at the moment, I broadly don't have a strong view on this one. I think at the moment it's probably okay to continue, would be my view, with the nativities and that.
Okay. Thank you, Mike. There's a question from Harriet. There's a lot of questions here about track and trace. Mike and I are not track and trace, so we'll try and help you through them. But we have been very clear that if you are uncertain about the advice you're getting from track and trace, then to escalate that up. But this is about a member of staff who's only been single jabbed, but is told that she doesn't need to isolate even though her daughter has tested positive. Is this correct?
No.
I'm not going to comment, and I'm not going to ask Mike to comment on the advice. I think I would say that in order to be very sure, I think the best thing is to get a PCR test or to take regular lateral flow tests.
I think unless you're double jabbed, you're not entitled to, you need to isolate.
Need to isolate. So it's rule, so yeah. That advice is incorrect. Thank you, Mike. So that advice is incorrect. Okay. I'll pick that up with Gemma. We've answered this one before. We have positive cases threatening to bring their children into school. Where do we stand? You absolutely stand your ground, and if you need to, then you can contact the police. There is a legal duty to isolate if you have tested positive, and it is a legal duty, and therefore you stand your ground that you've got the evidence that they're positive. They are not allowed into school. And then question from Nikki Harris. have told someone to remain away for 10 days with cold-like symptoms. No, absolutely.
They shouldn't have done that. That is wrong. They shouldn't be advising that.
So Mike's asked about lateral flow tests whilst waiting for the PCR test to come back. That is a good idea. We have mentioned that that is now advice that could be taken. Mike and I have an issue that is blanket advice at the moment. I think we're keeping that under review, but if parents are doing it, that's absolutely fine. And I think that goes in line with what we're taking away about lateral flow tests in primary schools anyway. There are a number of questions about school staff being eligible for the boosters and sort of lobbying for that. I am going to just give a pragmatic response to that. We couldn't get school staff prioritised on the vaccination programme before, and I think it's highly unlikely that will happen. It is still going down the agreed prioritisation list, which is done by age range. Would you accept that, Mike?
I go further than that. The thing is, it's got to be 6 months after your last dose.
Okay.
So once you're 6 months after your last dose, you'll be invited. If it's only 3 months since your last dose, you won't get optimal benefit from it, and you won't need it at this point anyway, because it takes 5 months for any deterioration. Also, to be honest with you, if you've had Pfizer, then probably the added value of the booster is probably less than it is if you've had AstraZeneca. The real worry group is the over 60s who had AstraZeneca 5-6 months ago. They're the ones who will now be seeing a deterioration and a reduction in their immunology. If you're an immunity, if you're a teacher who had it 3 months ago and it was for argument's sake Pfizer, then your immunity will be as good as ever and you don't need it earlier.
Okay, thank you for that, Mike. I think that clarifies that at the moment. I think with the action for us to take away about lateral flow tests, I think we were answering some of the questions that are coming through around that, and you've heard Mike's view on contacts and siblings in particular. Alan, I'm on your, there was a question about, is there a change in the variant, Mike? Is there a Delta 0.2 variant circulating?
So broadly, there are loads and loads of different variants all the time, but there is one that's got quite a lot of publicity at the moment. So when you look at variants, you're looking at three things of importance. One, does it make people much more sick? Two, how quickly does it spread? And three, and most importantly, does it dodge the vaccines? And what they're looking at the moment is about 6% of cases in this country are now due to a sort of a variant of the Delta, which is, it seems to be somewhat more, I mean, really somewhat marginally more infectious than the current Delta. So but it was identified first in July. It hasn't really taken off. It's only 6%. If you think about what happened to the Delta compared, what happened to the Alpha and then the Delta and how quickly they spread. So they were like 50% more effective than the current strains. This one's about 10% more effective. So I don't think it's going to make a big difference. It may sort of creep up the numbers a bit. It's not a biggie. The important thing about it is it doesn't seem to make people more ill. And also there's no evidence that it isn't susceptible to the current vaccines. So it's not something I'd be concerned about. However, there are new variants turning up all the time, and the higher the rates, the more these are chance mutations. The higher the rates in the community, the more chance you have of seeing a variant emerge. So I don't think this is the one, but there may be a variant in the future that really causes concerns.
Okay, thank you for that, Mike. There are a few points, I think, for us just to note the pressures in the system, which we absolutely do note the pressures in the system, and that it is very complex and will be made more complex, unfortunately. The local authorities making other decisions that we're not making at this moment in time, and but we do recognise that, as you know, Alan, I do recognise that. I did on Monday as well, and I know it is difficult. As I've said, your school effectiveness partners are on hand to help and support. There are a couple of questions coming through again around the impact of COVID on staffing levels, but then around moving to remote education for contacts and so on and so forth. So I want to be very clear here, and I might ask Mike to come in if it's not clear. So the public health advice which Mike is giving to you, is around management of the infection and infection control and prevention measures. And at this moment in time, we are saying that contacts are advised to get a PCR test, but we are not advising those contacts to stay off school for the test results to come through, but we will take the additional action about lateral flow tests coming through. So we are saying clearly that those children should not be receiving remote education whilst waiting for the PCR test to come through. If you are impacted by staffing levels, either through positivity or through needing to isolate, and needing to isolate if they're positive, or other issues going on that they can't attend school, and you are becoming operationally unviable, you have insufficient staffing to manage some class groups, or in secondary it might be year groups, etc., then we are supporting through the school effectiveness partners advice on, for a period of time, switching for a class potentially, or for a number of classes, to a remote education offer as a result of insufficient staffing in your school. We are aware that supply agencies are not there, they're diminished and drained, and so you might just be unable to operate as a result of staffing levels. Yes, of course, you know, we can't expect you to keep going with very low levels of staff with regard to everything. So if you need to make a decision to switch to a remote ed offer because of operational viability, then you can seek advice from your school effectiveness partner, but just follow your risk assessment and take that decision, or run it by your school effectiveness partner, and we will support that. But messages, one is an operational message and one is a public health message, so we just need to keep the lines of those very clear. So an issue about PCR test stocks are seriously controlled in the local pharmacies. That's about so need to be the infrastructure, so the infrastructure for lateral flow tests. Okay, sorry, I misread that one very quickly. I mean, if you book online lateral flow tests, they arrive in 24 hours. So if we do write that letter, we would probably advise parents to go through the online route, so we're not impacting on a huge demand in community services. But as a user,
we have them in our libraries as well.
And libraries, thank you, Mike. But as a user of the online system, it's very reliable and very quick. So I would advocate that as well. I use the library. Yeah, it would be encouraged, but obviously we can't enforce it in that regard. So that would be how we would respond to that. There's a concern there, Mike. We have a positive PCR case despite all lateral flows being negative. This is concerning. I don't know if you have a response to that. It's a thing. Yeah, I mean, lateral flows historically have only picked up about 50% of cases. Now they pick up about 70%, but they won't pick up everybody. And this is all about bringing the R value down as much as we possibly can. They're not, the lateral flow tests are not 100% you know, certain that you haven't got it if you're in contact. Even PCRs aren't, to be honest, but although they're much, much better. So so yeah, that is the thing. Okay. So there's a couple of points there about just the stress and strain on schools, particularly around the staff issue. Isabel, I don't think there's an answer to your question. I'm just reading it. Isabel's question is, I absolutely again about the stress and strain, but this is about people who are testing positive and the 10-day self-isolation rule. That is not going to change at all, Mike. So I think, again, this is just a feature of operating with COVID at this moment in time. That is the key protective measure, isn't it, Mike, which is isolating if you're positive. Yeah. Yeah. Okay, so there's some confusion, not confusion, I think that's probably perhaps the wrong word for me to say, but just there's an issue about the letter about the whole class getting a PCR test, and then those of you who are managing bubbles now, with regard to that, and you've got tighter bubble management. I mean, I think without taking that offline in an individual conversation, if you're able to identify close contacts through tight bubble management, no, you don't need to send the letter to the whole class. But if you are operating just with your classes and you feel the whole purpose of the class letter is to sort of broaden the testing of close contacts in a way that contact tracing might not pick up if you're not monitoring and watching the movement of the children in the class. If you've got the bubble management and children sitting at desks and you know where they are, and as we were in the summer term, and you're very clear who the contacts are, then no, you don't need to send more widely than that. But it's a balancing act. What we're actually trying to do is at least widen the contact tracing element of the system, as we said, because it is not reliable. Particularly in primary schools, it is dependent on the quality of the information the parent gives to the Essex, to the contact tracing team, and may not pick everything up. So there's a question about unvaccinated teachers. I know we've got Nikki on the call. I mean, basically, if you're not vaccinated and you are identified as a close contact, it is a legal requirement to self-isolate. So yes, you should be directing them to, that's not contact tracing because that's been done for you. But if they clearly have been unvaccinated, then they're not, they are required to self-isolate. I've got that right, haven't I, Mike?
Yeah.
I think, Claire, the question there perhaps is where they haven't been contacted by test and trace, but they are perhaps identified as a close contact to a positive in school, but they've not been contacted by test and trace. My understanding was that they're only isolating if test and trace contact them. That's the legal requirement.
That's the legal requirement. If they feel that they're at risk because they may be a contact, then I would suggest daily lateral flow testing in that case, just so that they know that every day they walk into school, they've tested negative that morning, just to be on the safe side if that's what they want as an individual. I hope that helps. Alan's disagreed with you on the parent evenings and invitations. So your disagreement is noted, Alan. I will say,
a few people are actually.
I will say what I've said throughout. You control your risk assessments, and if it's right for you to restrict attendance of visitors in your school, then that's part of your risk assessment. And please do take that decision if you're more comfortable with that. I think it's a question of just whether we issue that advice as a blanket advice from the local authority.
I think these people will be going to pantomimes, they'll be going to West End shows, they'll be going to football matches, they'll be going to this, that, and the other. They'll be seeing Santa. So I think that the marginal impact of you not doing it, I think it's all increasing the risk, but the marginal impact for you guys is probably not great. I think you could request if they kindly do lateral flow tests before they go there. But again, somebody did sensibly say that the position may be different as we get towards December. But at the moment, I don't think on a population basis that's going to cause any particular increases in cases, nor do I think it's going to particularly likely to seed it further within your schools. But I understand the reticence, and you know, it is difficult for me because I always want to do what will reduce the number of cases.
Okay. As I've said, we'll give some clear advice. You know, it's up to you in your risk assessment. So if you feel that you want to restrict attendance in your schools, then your risk assessment will drive that decision, and we will support that. I think Mike's just saying that we're not going to issue blanket guidance. Okay, thank you for that. There was a question about children being symptomatic but refusing to test, and the children, parents insisting the children come in. If you have identified the children as being symptomatic, again, you are quite within your rights to refuse entry into school. And indeed, the advice is that the children should be seeking a PCR test and only to attend if negative. So again, if you've got issues there, then you know, I know the difficulty and the challenge, but again, you know, the requirement is if you are symptomatic, you should get a PCR test. And if the children are not getting a test, Mike, what's your advice then? Because obviously the children can come in. No, if they're symptomatic, let me think this through. If symptomatic, they should be at home self-isolating.
Yeah, if they're symptomatic, they shouldn't be in.
Thank you.
If they refuse to, if they're symptomatic and they refuse to take a test, they shouldn't be in.
Yeah, okay.
I think though the flip side of that, which you know is a challenge for schools, is that some parents then and we've had a couple of comments and questions about this, that parents seem to be sort of gaming the system really and keeping their children off and just using that as an excuse to keep children off. So it is really tricky. I agree that they should be saying, yes, if you're symptomatic, you shouldn't come into school. But unfortunately, not all parents are entirely responsible or honest around this. So I think it just adds to the challenges for schools.
But as a public health issue, the advice is the advice. You know, I recognise the issue.
I understand that. Unfortunately, the pressures on schools are multiple, including attendance, and so we're having other pressure from the DFE around attendance. So it's tricky.
Yes.
There is a lot of back balancing to do here, and a lot of pressures coming through. So thank you for that, Pam. Absolutely. You know, it probably is the most challenging time. I dare say it gets more challenging all the time, doesn't it, really? Nick, I've just read your question around the need to cater for vulnerable children and key workers, and closing for operational reasons. Again, I think that would need to be an individual discussion with you. There is an expectation from the DFE that there will be an offer for vulnerable children, not key workers. I think I've clarified that there isn't key worker status anymore, so it would be for vulnerable children. But if you're not able to cater for your vulnerable children, then again, you would just need to be very clear about what eyes and ears you've got on your vulnerable children whilst there is a remote ed offer going on. But the priority would be your vulnerable children. That certainly, if you are asked again by the DFE about the reasons for closing a bubble for operational reasons, then the question will be about what are you doing for your vulnerable children. So as long as you can answer that, I'm not hard and fast here. I go back to the fact it's your risk assessment, your decisions. We can advise, we can support on that, but the question will be how have you got oversight for your vulnerable children?
We're all gone quiet. Is that a thing?
No, it's me.
We're reading questions like fury. There's a question from Llewellyn asking, do we have to take, or do head teachers have to take temperatures of pupils? My understanding is no, you don't, but no. I wouldn't go there, frankly.
No, I wouldn't go there, no. You know, again, we've advised on this all the way through. Yes, if you have that as part of your risk assessment and that's what you want to do, that's absolutely fine. But if a parent will not partake in that, you can't force them to do that. It was Helen's question that stumped me a little bit, sorry. Helen Riddle, about the cost of supply cover. We were able to get supply, but the cost of cover, for example, a teacher who's isolated for 10 days is prohibitive, and the amount spent on supply would concern. There isn't any financial support, if that was sort of behind your question, Helen. I'm afraid there is no recourse to financial support around that. Again, you'd need to take a decision about whether you can get supply in versus you know, operational viability and what that might look like. So again, I can't take that decision for you, unfortunately. I can't advise on that, but no, I'm afraid we haven't got financial support to help with that. We just wouldn't have that. There's a question from Sam, Mike, what is the current rate, R rate? Is that still a thing, R rate?
Yeah, it is, but it's not something we're generally shared at the moment, but you can work it out. So basically you can base it on the doubling time. So I would say in Essex at the moment, it's between 1 and 1.1, but going in the wrong direction.
Okay, thank you. And then there's an interesting question from Helen again, Mike, about unvaccinated staff who are contacts but have no underlying health conditions. Can they come in? And then using the flu analogy, that you would not stay at home if you've got flu. I think it goes back to the law around coronavirus. If you are identified as a contact by track and trace, and you are told that you are a contact, then you have a legal duty to self-isolate if you are unvaccinated. I think
Correct.
that's the difference between that and flu, for example.
Yeah, correct.
Thank you, Mike.
Claire, there was a question before about should those over 60 who had the AstraZeneca jab 5 months ago be taking extra precautions?
Well, you're far too young, obviously, but this is, so I'm going to show, I actually did see this one. I'm going to try and share my the picture so I can show you. If I saw the rubbish on my thing, and where am I? Here we go, this one. Can you see that?
It's very small, but we can, Mike.
Okay, so basically this is quite a complicated slide, but this shows the waning of immunization by different vaccines over time. So the important one, I think, is this one. This is hospitalization rates, chances of hospitalization and effectiveness of the vaccine. And these are weeks. So this goes up to 20+ weeks, so about 5 months. And you can see that the AstraZeneca goes from a position where it's about 96% effective in preventing hospitalization to a position where it's about 80% effective after about 5 months. For those of you who had the Pfizer, you'll see at the end of the 5 months, it's still as effective as 2 doses of AZ was in the first place. So this isn't really an issue, I don't think, for Pfizer. It's an issue for those people who've had AstraZeneca, particularly those who are at most risk. So
having said that, Mike, sorry to interrupt, but one of the things that I've certainly read about in the press is that the difference between the two jabs may be that the Pfizer has largely been used for younger people. So you've actually got a different control group with the AstraZeneca and the Pfizer. So would that make a difference as well?
yeah, well, they control that, so they can control for age within this.
Oh, okay.
And you're absolutely right that the immunization wanes quicker in elder people.
Yeah.
So, but
the risk of hospitalization, of course, is greater.
Yeah, and they had the vaccines earlier, and they had AZ rather than Pfizer, as you rightly said, in many cases. So the imperative is older people with AZ need to get the booster. But actually, if going back to as an older person with AZ and over 60 with AZ, I can live with 80% for the next month or two. So I think you pay your money. I don't think. I mean, I think you don't shake hands with people, you don't hug people who except for family, and you don't go within 2 meters of people if you possibly can. Otherwise, but broadly speaking, I don't think you have to sort of go into self-isolation or anything called shielding just because you had the AstraZeneca 6 months ago.
Okay, that's very helpful. Thank you. Thanks for that as well, Nikki. I've lost my place in the.
But just while I'm here, so ditto Dawn's question, are there any plans for boosters for the under 50s? No, for the reason I've just shown, because actually, even after 5 months, the effectiveness of the double Pfizer is as good as the AstraZeneca was, when it was first given. So I think that there isn't going to be a big impact on that group. So I think at the moment there are no plans for that.
But Mike, quite a few of the over 40s have got the AstraZeneca vaccine. Speaking from personal experience. Yeah,
but again, I think the overall risk, I mean, is quite low in you as your absolute risk. So that's the reductions in hospitalisation against what your original risk of hospitalisation was in the first place, which is pretty low at that age.
Okay,
and I can't believe you're over 40.
It's a question from Mary about covering a class with an LSA if there's a parallel class teacher. Leading, yes, that's absolutely fine in terms of managing the pressures on staffing at the moment. Absolutely do what you can to stretch your staff to the very best that you can without overloading them. I've confused Llewellyn about putting the school into bubbles as normal. No, sorry, that was, if I have confused you, my apologies. No, the bubble management is a COVID protection management. If you've got a spread of the infection in a group, you might want to go back to some form of bubble management with regard to that. If you are just struggling for staff all the way through, then you might want to send a class home, if I've confused my language around that. It's still trying to keep, I know it's confusing, but it's trying to keep the infection control measures through your risk assessment and just trying to keep the school operational, basically. Again, I think we've dealt with Helen's question. Strong plea from Liz not to blanket advice. I think we agree with you at the moment. Liz, is not something that Mike and I are keen to do, partly because for some of you, you're in very difficult and challenging circumstances, and we absolutely get that, and we want to help and support you through those challenges. We absolutely understand that, but not every school is in the same boat at the moment. And I think Mike and I would only discuss blanket advice if we felt it was in the best interest of all schools and all children, young people, and the families and staff. And at the moment, I think it's really difficult to do that, because for those schools where the advice would help, we are happy to issue the advice. But if you're not in the same situation, the advice might actually be unhelpful for you. And I do get that as well. So at the moment, my email of Friday still stands. It's about working with you on an individual school by school basis.
So Claire, on a sort of non-medical or a non-clinical question around Ofsted, and I know that in the pre-questions we were asked the question, and I think we all know the answer, that if a head teacher is off with COVID and has an Ofsted call, can they ask to defer Ofsted? And I think we know that the answer to that is no. But having said that, is that something that we can take back to Ofsted as a lobby group? Because we know that in the vast majority of cases, if not all, the head teacher being unable to be present for an Ofsted inspection is really detrimental to the school. And I think we need to be giving that message back to Ofsted if we can.
Okay, Pam, I might need to check the detail then, because my understanding is that if you have got issues affecting your school linked to COVID, you can ask for a deferment. I'll check the guidance and reissue the guidance. We did send that out. We did have this question on Monday, but I will triple check the guidance to make sure I'm clear. We are aware of a couple of schools that have asked for a deferment, and that was given. So that my understanding is slightly not quite your understanding, Pam. So
okay, I'd be delighted if I was wrong on that, but I'm also aware of a school yesterday. The head teacher was there, but half the school wasn't, and their inspection wasn't deferred. But yeah, that would be. So
I think the issue is you need to ask for the deferment. You can't say.
No, they did ask for a deferment, but okay. Yeah, but no, that I would be delighted if that was not the case, because I think many head teachers believe that that is the case, that if they're out for COVID, they still can't defer an inspection. So it'd be good to clarify. Thank you.
I'll relook at the advice on that one. Okay.
Hi, Pat. I'm just going to jump in, Claire, because I had the Ofsted phone call Monday, and it was the initial notification of my Section 8. And I just explained about how many staff I've got, which is 3, including my literacy lead, and 30 pupils. And at that point, the administrator suggested that I put it in an email and she would request a deferral. I then waited 2 hours and it was confirmed it was deferred. So I didn't request it, it was suggested, which was really helpful because it would have been a very tricky inspection. But yeah, so it was deferred in my case. And I am aware of one other head teacher who is off with COVID, and that was also deferred. So I think they do take it into account. And I did read the deferral sort of the categories for which you could defer. I didn't really fit into any of the normal categories, but at the bottom there is a bit about COVID during the pandemic. So I think it's probably because of that. And I also think they probably didn't want to come into school with so many COVID cases, but yeah.
That might well be the case. That's really helpful, Paula. We'll get some clarification out there. I definitely know that they are willing, if you ask, or willing to suggest, if they suggest to you that they will take a COVID into account as part of the deferment criteria at this moment.
I think at this point it's quite tricky for Claire to be trawling through the questions. So if there's anyone who doesn't feel their question has been answered, could people jump in, be big and brave and jump in with questions, just so we make sure that we are covering questions from people?
I just wanted to say thank you for the letter. If it does come out, I think it'd be really helpful. I think that within communities, the messaging from the government isn't always clear. And I think people are kind of taking lovely, big, refreshing, everything's okay breaths at the moment. And I think a letter from the local authority to make it clear to parents that, you know, caution is still advisable would be really, really helpful.
Thanks, James. I think that's really helpful, at least if nothing else. We'll take the LFD away, as I've said, but even if we just issue something about asking parents to be more cautious, which we continue to do, but I do get the sense that in all other aspects of society, many people feel that COVID isn't a feature anymore, and I do get the challenges for that. I think some of the questions being answered themselves, Pam, around perspex screens and things like that. I
think Dawn wants to jump in. Is that okay?
Claire,
yes, of course.
nice to see you. Thank you.
Hi, Dawn.
Hi. Can I just ask, I had to miss the start of the meeting, but staff going abroad, what's the payment on that now? Has that changed? Do they get paid if they come back with COVID, or do they not? Because of the restrictions listing. I might have missed it. I'm sorry if I have.
Right, don't worry. Yeah. Nikki's on the call, Dawn. Nikki?
Thank you, Nikki.
Hi, Dawn. Yeah, sorry, I did answer that in the chat, but that's fine.
Sorry.
If that, no, that's fine. If they go abroad somewhere which requires isolation on return, then obviously no pay, because they know that they can't attend work. If they go abroad and get COVID, unfortunately, they're then sick and have to isolate, and that's a slightly different position. But if they have to isolate because of the travel rules, the red and all of that, then no, they shouldn't be paid, because they know that that's the case before they go.
To take each individual case and talk to you then. Okay, thank you. Thanks very much.
Nikki, whilst we've got you, I know you've answered this in the chat as well. There's still uncertainty around third trimester staff who are pregnant. Can you just talk through the advice so everybody hears it? I know it's in the chat as well.
Yeah, I mean, there has been no change throughout to the government advice on this, that 28 weeks plus should be out of school wherever possible. It doesn't mean they can't come in. If they're happy to come in and you and they are happy with the risk assessment, then they can. But the general advice is that they should be facilitated to work from home. Generally, medical practitioners are kind of taking a neutral stance and saying it's between the employee and and their employer, but quite a lot of them are saying that the person shouldn't attend work, and that is the government's advice, that they shouldn't attend work at 28 weeks plus. We're also having situations where, because people are not having to attend work, they're changing their start date of maternity to the day the baby's due, and as long as they give the 21 days notice required, there's nothing you can do about it. That's their entitlement under terms and conditions.
Okay, I hope that's clear. And then the question about the letter again, about the contact letter that we've issued a couple of times now, does that kick in with a lateral flow test, or must it be a PCR test? It needs to be a PCR test, because it's the PCR that would trigger the contact tracing from the contact tracing team. So the lateral flow test then goes to a PCR. The PCR confirms positive. That goes up to NHS test and trace, and the contact tracing starts from there. Our letter is then to supplement the contact. So I hope that's very clear. So Nikki, the question of unvaccinated staff and pays come up from Sam.
Okay, so unvaccinated staff who are required to isolate by test and trace are entitled to be paid because they are legally prevented from attending work, and therefore under terms and conditions they're entitled to be paid.
Okay, thank you. And whilst we've got you, is there any funding to support the cost of supply cover for women who are working or who are at home under the advice to stay at home?
Unfortunately not.
Okay, thank you. Okay. And Mike's been told differently to what I've just said to you about the letter around the lateral flow test. I mean, that letter is there to help you. I can't comment on track and trace. It was there to help you. It came about because we had a school that had a very clear PCR positive case, and then there was little, if not negligible, contact tracing done. And Mike and I met and we talked about it, and we issued that letter to help with the contact tracing. That letter is to help with the contact tracing. If you want to send it out under the lateral flow test, that's fine, but the PCR may be negative, and therefore you sent a letter out to get PCR tested for your whole class. That PCR testing is not going to hurt your class. It's not a bad thing to do. It's just that the positivity hasn't been confirmed. So again, you know, it's difficult to give you a hard and fast rule when to use it. The intention was to use it if you had a positive case via PCR. The frequency, you don't need to do it any more than once a week. The last thing we want you doing is sending the letter out 3 or 4 times for parents to get the PCR test. But that was the advice. If test and trace have told you differently, I wouldn't worry about it. This is all about testing, so it's not a bad thing. It's a good thing with regard to the testing. Okay.
Claire, there's a couple more HR ones if you want me to address those.
Yes, please. Yes,
please. Further advice about staff who are not vaccinated taking reasonable steps to ensure they're available for work. Yes, I think you should be having those conversations with unvaccinated staff to say, you know, clearly the position is if you are contacted by track and trace, you would have to isolate. Therefore, we urge you to take, you know, all reasonable measures to keep yourself as safe as possible in terms of your proximity to other people, etc. But ultimately, you know, they're entitled to be paid and they will have to isolate if contacted by test and trace. But yes, I mean, I would be having those conversations. And there was another question about recommending that staff teach remotely from home.
Marie Cook leaving? What's her leaving day?
Dawn, it's off now. Okay, carry on, Nikki.
Are we recommending that they teach from home during their 3rd trimester? Yes, absolutely. Anyone who is having to isolate and work, not attend work, is being paid and should be working from home wherever possible. Now, we appreciate that not all roles can be done from home, and it may not be appropriate to be doing remote teaching. But they can be asked to do that. They're certainly being paid to work whilst they're off. But alternatively, you know, anything that is reasonably within their job role that you can ask them to do, get them to do. They certainly should be doing whatever possible to work from home. And then, Helen, your one about not contacted by track and trace. I'll rely on Claire or Mike to correct me here, but my understanding is if they are contacted by track and trace, they are legally obliged to remain at home for the 10-day isolation period. If they are not contacted by track and trace, there is no legal requirement for them to isolate.
Yeah, that's correct. But what I would say, Helen, is if they are concerned because they think that they have been contacted because test and trace, you know, are not perfect, then I would say to compensate for that perhaps you should ask them if they're willing to take a daily lateral flow test. So for those 10 days, every time they come into your school, if they are concerned that they have been a contact, then at least they're coming into your school every morning with a negative lateral flow test, and that will be a way to manage and mitigate the concern that they have. But there is no legal requirement for them to self-isolate and be at home. And I don't think you should expect them to do that given all the pressures we've had on staffing. But if they are concerned, then test daily is the way to mitigate that concern. And it looks like that's a positive outcome there for you. Okay, thank you. I'm conscious we've only got 4 minutes left. Are there any other pressing questions, particularly for Mike, because he probably does have to dash on the dot? Are there any pressing questions for Mike? No? Well, given the fact there was a high volume of questions, I'm surprised we've got through it. I absolutely appreciate the complexity of the information, and it is not easy. And I think today's conversation has absolutely highlighted that. We're just going to have to navigate these murky waters the best that we possibly can. And again, you know, take the decisions that you feel are in the best interest of your children, young people, your families and your schools. I understand the pressure on parents. They are they are pressurizing. We do get that. And if we can help with that, we will try to do that. We'll definitely reissue the advice about deferring inspection. Mike and I will go away and talk about any advice on twice weekly lateral flow test for primary age children. All I would say is please just keep doing the brilliant job that you're doing. I know you're making tough decisions every day. Keep going. You are making the right decisions. I think the data suggests that. And if Mike and I were concerned that that wasn't the case, then we would be talking to you about changing our advice and issuing more blanket advice. And I think we've explained why we're not going to do that at the moment. And we will continue to keep everything under review. Your school effectiveness team are there for you. Essex Test and Trace are there for you. The heads of education, the assistant directors, myself, if you need support, we're on hand to help with all of that. But keep doing the brilliant work that you're doing. You are doing the very best by your children, young people and staff. Well done, everyone. And please do get a rest during half term. I know it's been a really tiring half term for everybody.
Thank you, Mike and Claire, informative as ever. Thank you very much for answering a raft of questions there. And there's been a few questions in the chat about having another one of these, which we obviously will do in liaising a time that's suitable for both of you. So thank you very much, everybody. Have a good half term, and we look forward to the next one.